This Powtoon was created by the Rehab Rockers to give background information on stroke and to depict a typical patient journey through the acute stroke service. Considering there are more than 100,000 strokes in the UK every year and almost 2/3 of stroke survivors will leave hospital with a disability, it is important to ensure people can go on to enjoy life post-stroke with the right support and ongoing care.
A patient embarking on a journey through the stroke pathway will need specifically tailored, high-quality care, provided by a multidisciplinary team of health and social care professionals from acute care to long-term rehabilitation. The National Institute for Health and Clinical Excellence is responsible for providing national care and treatment guidance, which support the stroke rehabilitation of adults and use the best possible evidence to ensure organising, planning and delivery of care is of the highest standard. Patients admitted onto the ward were confirmed as having a stroke or a TIA. A stroke is a serious medical condition which occurs when blood supply to part of the brain is cut off. A stroke usually presents common symptoms, including drooping of the face on one side. The patient is often not able to smile, or their mouth or eye may have drooped. Another common symptom of a suspected stroke is that the person may have lost functional mobility within their limbs. Individuals often present with slurred speech or talking but making no sense. However, sometimes people are not able to talk at all, despite appearing to be awake.
There are two types of stroke: ischemic stroke, which is where the blood vessel bursts in the brain, and a hemorrhagic stroke, which is where there's a blocked blood vessel. Depending on what part of the brain that has the bleed or blockage will determine what functions in the body will be impaired. When a stroke affects the frontal lobe in the brain, emotions, reasoning, problem-solving, movement and speech can be affected. When it affects the parietal lobe, movement, sense of touch, recognition and orientation can be affected. With the occipital lobe, where visual information is held, black spots, visual impairment and in some cases blindness can occur during a stroke. The cerebellum, balance, coordination and equilibrium can be affected, and with the temporal lobe, memories, recognising and understanding speech can be affected.
When a patient becomes aware of the service and their diagnosis, they are introduced to the MDT and their individual roles. Patients may have some awareness of their symptoms due to previous national campaigns.
When patients join the service through A&E, they are admitted to hyperacute ward for up to a maximum of 72 hours. They undergo an initial assessment, CT scan, and begin to discuss stroke prevention. After this, the service then aims for the patient to be transferred to the specialist stroke ward.
When a patient uses services in the acute stroke setting, they will interact with a large multidisciplinary team to receive medical and therapy intervention with the aim to support them in their recovery journey. Cognitive and functional assessments are carried out to assess areas of need for patients.
The patient exits the acute stroke service dependent on their level of recovery and additional needs. The OT and MDT will discharge plan in collaboration with the patient and their family to make sure the discharge destination is the most supportive environment possible to enhance further recovery.
Created using Powtoon.